We'll talk a little bit about program evaluation designs, because a lot of what you'll be doing as public health and others is evaluating programs or treatments. The designs assume that there is some intervention or program or treatment or medicine or policy that's going to be evaluated. And we want to evaluate the success of a program or policy, etc., by assessing outcomes. Some types of outcomes could be knowledge, attitudes, or behaviors, observed behaviors, physiological measures. Physiological just meaning maybe you take a blood sample and you're measuring different levels in the blood, or you take blood pressure or heart rate, and then system level indicators. Moving forward, the design will help you determine how to evaluate the success of an intervention by determining dependent variables and independent variables and what statistics you should use. For more about program evaluation, you can look at this CDC website. This is a really great resource to learn more about program evaluation. It's just super important in the health field. So the types of program evaluation, we might just have one group that we're looking at. So maybe we have one group and we're only measuring them after their intervention. So we do the intervention, maybe we have a health fair, and then we're measuring their knowledge on a topic based on their attendance at that health fair. That would be a one group post-test only design. A one group pre-test post-test design would be us measuring their knowledge before they come into the health fair. Then they go to the health fair and walk around and talk to everyone. And then as they're leaving, they complete that same collection, that same outcome form as they did beforehand. And then we compare their results from before to after the health fair. Then we have multiple group program designs. So if we have two groups that we just have naturally occurring, but we are only testing them after an intervention, that would be a post-test only comparison group design. So maybe your health clinic has some program and we want to measure their levels of stress. And then we have a compared program somewhere else in the community that's not giving the same program we are, but we want to measure their levels of stress too, to see if our program group has a lower level or not. If we have a control group, this just means that participants were randomized into those groups. So a post-test only control group design would be we had all the individuals at the start. Then we randomized them into two groups, one that received the intervention and one that didn't. And then we measure their outcomes at the same time point after the intervention for the one group. And similarly, the pre-test, post-test comparison group has two groups that we measure at two time points, before and after an intervention. And then the randomized groups would be a control group design.